I spoke to Xi Chen. He's an assistant professor at the Yale School of Public Health and president of the China Health Policy and Management Society. He spoke about the potential growth of medical tourism in China.
I think it's still in the developmental stages, but things have been changing in some aspect. First is the population aging is more rapid than before, so the chronic disease like cancer treatment, people have more demand to think about where to get it treated. And also, compared to the last few years, now the China's drug availability is improving. Medical devices have been more and more imported to the country due to the fastened, accelerated drug approval process. And also, since economic growth has been keep continuing for quite a few decades, and there's a larger class of middle-class people who have purchasing power to choose where to get treated. The middle-class people, they really want some higher quality of treatment. And lastly, I think it's a policy change. In the last few years, Hainan has been developed into a free trade zone, and thanks to the government's really pro-business model trying to promote this for the whole province.
You mentioned Hainan. We just had a piece on about that. Any other potential medical tourism hotspots that you can envision in the future in China?
Quite a few, but we may need to start from less severe conditions. For example, we are now talking about cancer. For cancer treatment, that's very, very severe condition. So the patients may still want to go overseas, but there are much lighter conditions like the care, rehabilitation after surgery, and medical beauty and plastic surgeries. Those things are less severe. I know the medical tourism zone has also developing some centers for medical innovation, for device availability and medical education, R&D. So we know that the service price in China is much lower than the Western countries. And also for physicians, their pay is much lower, and their skill is sometimes better because they perform more surgeries in China than those developed countries.
Let me ask you about something else. Nature magazine had this story from September of 2018. I'm just looking at the headline, Why Chinese Medicine is Heading for Clinics Around the World. And it talks a lot about traditional Chinese medicine and this urge from people all around the world to kind of seek it out. Is that going to be a huge draw moving forward?
Yeah, exactly. I think that's a great point. Traditional Chinese medicine is a good cure for certain disease, especially like end-stage cancer. This has been more effective than westernized medicine. So I would expect more patients at the end stage of cancer will go to Hainan and other places in China because those patients are not able to travel 13 hours or even more to get treated. And very importantly, the continuation of the care is important. Even if they get better surgery in Western countries, but if they are not having a continuous care after they coming back, the recovery rate is still low. So the data shows that the cancer survival rate in China and the U.S. has been a large gap, but the mainly attributable not to the surgery, but to the recovery.
Xi Chen, always a pleasure talking to you. Thanks so much for your time.
Thank you.